as physicians of Bahrain or Norway, which is higher in comparison with Jordan and lower in comparison with Canada. We use these countries because they use the same tool as we did, and they do not go for any prior training, and they didn't evaluate. I mean, like, this is not an evaluation study. And in adjusted analysis, as I mentioned earlier, we found a statistically significant difference between GPs and specialists, which was consistent with the previous study conducted in Saudi Arabia. And as a final thing, our strength of the study is this is the first study to be conducted in Erevan, and to our knowledge, this is the first study to identify an association between GPs versus specialists with the EBM practice using multiple logistic regression. And the limitation was that we, as I mentioned earlier, we left the questionnaire at the physician's office, and we might expecting that they might have consulted with their colleagues, or they might have used other sources. However, we mentioned them that not to do those things, but we cannot assure that. And the other limitation is we use a convenient sampling. This might have limited the representativeness of the sample and generalizability of the finding. So in conclusion with all our findings, we came up with the two recommendations. The first one is educational program for the physicians on EBM skills and practice. And the second one is the suggestions for the Armenian government to introduce and implement guidelines-based clinical practice at national level. Thank you.
Questions? Thank you, Shabita. I have a question about your questionnaire. Have you pre-tested it?
Yes, I pre-tested among the physicians who are not working in the polyclinic, because by then we didn't have any information about how many physicians are working in the polyclinic. So we pre-tested among 25 physicians, and also among CHSR people.
Okay, because you had a lot of unaware, don't know response options, yes?
Yes.
Close to half of the participants sometimes answered. Is it a possibility that they didn't understood the question rather than the idea behind it?
But in pre-test we didn't face such problem. But anyway, for technical terms or resources, if the word is it is difficult to translate in English, we, to Armenian, we also put them in English for easy understanding.
Okay, thanks.
Welcome.
Thank you, Shabita. I have a couple of questions.
Yes.
Could you go back to your slide where you show the evidence-based medicine in Armenia in your background section?
Yes.
Yes. So you started describing the conferences that took place in Armenia starting from 2012. Does it mean that there was no evidence-based medicine practiced in Armenia before, I don't know, 2012?
According to the literature, when I searched, I didn't find. But when during our analysis, we asked them a question about did you add a previous training, and there was a question as like when and where. And there was a couple of people in 2005, they had a training on National Institute of Health. But before that, we didn't find any information. That
like
was
about
the latest information.
Evidence-based guidelines that are practiced in Armenia?
We didn't find any information about it.
Okay, so perhaps it makes sense if you're going to publish it to provide more detailed history of this.
Mm-hmm.
My next question is about you had in your recommendation that educational programs on EBM skills should be provided to general practitioners and specialists. So what should be included in these programs?
Yeah. The EBM practice, as I mentioned, there were 3 methods to move from opinion-based to evidence-based medicine. There were EBM steps. This is the basic thing to practice. There will be 5 steps: asking questions, and then critical appraisal of the article, finding evidence, and then guide them how to use evidence in their practice, and finally to evaluate whether their practice is improving the patient care or not. And apart from that, there was a that's it actually. Yeah.
Okay, so I was just wondering about the availability of materials in Armenian language. So I mean, they can receive training, in skills, but if they can't read scientific articles, then this is going to be a serious barrier, despite all the skills that they might receive during the training. Okay, my third question refers to your attitude score.
Yes.
So could you clarify again how you calculated your attitude score?
Yeah, exactly. The attitude score is it had 8 questions, and then we removed 2 questions from calculating the score. The one is the repetition of the same as attitude of healthcare colleagues towards evidence-based medicine. There were 2 questions basically on this. We removed both because the attitude of healthcare colleague is not referring their attitude, so we removed those
I
questions.
remember asking you
Yeah.
during the rehearsal, so I wanted to check. Thank you.
Thank you.
Thank you, Shabita, for
Thank
an
you.
interesting presentation. I have 2 questions. You mentioned that the knowledge and practice differs between GPs and specialists according to literature. Can you elaborate more in
Okay.
where two questions
In fact, there was only one study conducted on that. Majority of the studies, which is basically like at the center, and this study said that the GPs are performing more than the specialists, and the rate was the GPs are performing 65%, and the specialists were 50% of the specialists are using EBM.
Thank you. And my next question, did you check the literature about how the presence or absence of a national EBM guideline influences the knowledge, attitude, and practice of physicians and
Yeah.
professionals?
We didn't get a clear idea because there was still lagging in the literature, but we found that if I'm not mistaken, like maybe one of my examples from yesterday Shoga's presentation, she mentioned that in Iran they use mainly clinical guidelines. This was the difference in the outcome between the Armenia and Iran. I guess that might explain your, yeah?
Thank you.
Thank you.
What sorts of biases do you think could have affected your results?
As I mentioned earlier, we left the questionnaire at the physician office. That is one of the bias. And the other
Explain how
one...
that's a bias.
Pardon?
Explain how that's a bias.
Okay, they would have discussed with their colleagues, or they used other resources to answer the question, and moreover, it's a self-reported.
Right.
So we are expecting that this might not be the actual result of what we are seeing.
Okay.
Thank you.
And what else? What else might you postulate that could be a bias? Related, I'll give you a hint, related to self-reporting.
Related to?
Related to the self-reporting.
How might self-reporting increase the bias in the results she does?
And thinking about the way the questions are worded.
Your answer is saying they had to choose agree, don't agree, right?
Yes.
That you could not evaluate if they really
Yeah.
understood.
That's why I said it's a self-reported.
So also they might be wanting to impress you. There might be a bias in terms of being overly positive, wanting to show more knowledge than they actually might have.
Yeah.
Thank you, Shabita, for the very interesting presentation. I just wanted to ask you about that 3 countries that you presented
Yes.
and their EBM. Could you go to that slide, please?
Yeah, sure. You mean the comparison
Yes,
or
of
the...
Norway, Canada, and Jordan.
Okay.
These countries,
Yes.
the physicians that you mentioned, these are primary healthcare physicians?
Yes, primary healthcare physicians.
Oh, okay. Okay, thank you.
You're welcome.
So if, for example, we assume that the statistical significance that you saw between GPs and specialists, assuming that that is not affected by the biases inherent in self-report and leaving the questionnaire there. So assuming that what we're seeing is actually real. What interpretation would you give? Why would GPs in Armenia be using evidence-based medicine more than specialists?
Okay. For example, as they mentioned, the GPs, they added they have their own for example, the GPs are family medicine and internal medicine. And the family medicine, they are conducting their own conferences, and they are like more of having a case study, case presentation, and they are also having a training on evidence-based medicine. I guess this might be one of the reasons for the differences.
And my last question is, you mentioned the two conferences that
Yes.
sort of kicked off this movement, if you will. Did you have a measure about whether these physicians were at those conferences?
Yes.
Yeah.
When
I'm sorry
we-
if I missed that.
No, but I didn't mention, but we measured. When we asked about the training, and then we are, as I mentioned to Dr. Zovina, we asked them when and where, and we found that majority of them mentioned about these two conferences, and also about NIH.
Just a suggestion, Shavita, for your paper, when trying to interpret your findings regarding the difference between GPs and specialists, you could mention that significant donor-supported efforts were helping to provide more up-to-date trainings for family physicians particularly, and the GPs are mainly trained as family physicians, so that could probably explain that they have had exposure to more recent trainings, refreshing trainings, rather than the specialists. So this could help your discussion.
Yeah, thank you.
Thank you.
Yes, I would like to thank my advisors. I bother them every day. If I'm not getting one day mail, I'll just go panic, and then I'll write them 2 more mails. But I really want to thank them because they were so supportive and so friendly. Even sometimes when I upset because I faced a lot of issues in data collection, they sometimes call me and they convince me. They were stress reliever for me, and I'm really thankful for the faculty of SPHS, and thank you for Dr. Vatuki Petrosian. She was my mentor. Whenever I upset, I go talk with her. And really thankful to all my friends. Without them, this data collection will not be possible at all. As a foreigner, when I went for data collection, every day I finish my medical classes and I come here. There will be someone sitting in the Sohi canal tell, come with me. I need you for data collection just for an hour, and then I take them. No. Really thankful for everyone, all my friends who came here to see my presentation today. Thank you so much. Thank you for spending your time to me. Thank you.